Chapter 25, Local Treatment of Chronic Urethritis. The treatment of chronic urethritis is entirely empirical, as is the treatment of chronic catarrh of any mucous membrane. So much depends upon the physical character of the patient himself, and so much upon the precise way in which local treatment is conducted that it is impossible for any two men to treat the condition by precisely the same method. It is to be borne in mind that the milder forms of chronic urethritis tend to get well spontaneously under proper general and sexual hygiene. The cases that resist local treatment most effectively are not those that most seriously threaten the patient's health, but rather the minor catarrhs, while the more severe inflammations, such as stricture of the anterior urethra and marked suppuration in the prostate and seminal vesicles, usually yield to intelligent local treatment. But it is impossible to decide beforehand precisely what treatment will suit a given case. The most anemic and neurotic patient may be cured by a few irrigations, while the most robust may show a slight catarrh that resists every local and general measure. It is of the first importance, therefore, that the patient's general and sexual hygiene be closely investigated, and every effort made from the outset to put him in the best possible circumstances for overcoming his local inflammation. Page 223. In the second place, it is important that whatever local treatment is undertaken should be given for the definite purpose of curing a known lesion. Yet this local treatment should be carried out in a purely tentative way, for it is impossible to decide beforehand which of the various lesions along the urethra is the important one, and it is equally impossible to be sure whether any form of local treatment will do good rather than harm until it has been tried. It is therefore necessary to conduct treatment with a close eye to results and, unless some definite change for the better is promptly perceived, the treatment must be changed. In making these changes, it is wise, every little while, to take a breathing space, to stop all local treatment and give the urethra a few weeks' rest, controlling the discharge, if need be, by an anterior astringent injection. Bearing these general considerations in mind, we may proceed to detail the methods of treatment employed, beginning with those most commonly used and ending with the ones that are only required for exceptional cases, and not forgetting hygiene, page 223.